Good afternoon, everyone, and welcome to the first federal virtual town hall on older foster youth. My name is Sixto Cancel, founder and CEO of Think of Us. Tuning in today are hundreds of older foster youth advocates, child welfare leaders, including state commissioners and their staff. I want to note that this virtual town hall has a limit of 1,000 viewers, and we are at capacity. We also have a waiting list of 1,500 people, so there is a clear need for this information. If you know someone who was unable to join, please let them know that we are recording this town hall and we will make it available for their viewing after it concludes. The COVID-19 pandemic has dramatically and very quickly changed everything about our lives. It is a scary and uncertain time, especially in our community, but there are things that we can do. In order to take fruitful action, we need to hear directly from those being impacted. We have convened this town hall to discuss some of the immediate and pressing issues that we are facing. In our registration process, we have had over 1,400 different submissions of top priorities and questions youth are worried about. The top 10 are in order: food, housing and shelter, healthcare, including mental health, testing, insurance, technology, access to laptops, internet, Wi-Fi, financial assistance, bills, reimbursements, employment, transportation, education, household supplies, parenting, and childcare. Before we start, I would like to thank Dr. Jerry Milner, Associate Commissioner at the Children's Bureau in the Administration of Children and Families at the United States Department of Health and Human Services, for joining us today and for all the work you do. One final note, we stood up an emergency town hall over the last 40 hours, so I also want to thank all the partners who have helped mobilize. Let's get right into it. In the last 40 hours, we have asked several questions and asked people to share their experiences. I want to share some of those with you. One young person reported in, "I'm out of work due to COVID-19 and probably will not be able to afford my bills. My program hasn't said anything, and I'm soon to age out. I'm worried about what will happen." Another young person shared, "I aged out 2 years ago and have been couch surfing since. I'm homeless and just had to leave rehab. I want mental health services, and they said I have to get a physical before I get into a housing situation." Dr. Milner, can you please quickly tell us about what is your role at HHS, and also what is HHS doing to help older youth at this time?
Sure. Thank you, Sixto. And I want to thank publicly Think of Us for all of the work that you've done to elevate these concerns and to put together this webinar in record time. You've done an outstanding job, and I'm actually quite grateful for that. I'm the Associate Commissioner at the Children's Bureau. For those of you who may not know, the Children's Bureau is the oldest federal agency devoted to meeting the needs of children and families across the country. And we operate the programs from the federal side in child protection services, foster care, adoption, transitional living services, the Chafee Independent Living Program, and others. I want to take just a few minutes to talk about why this call and why this time is just so critically important to us right now. First of all, I want to reiterate what Sixto has just said, is that the call is really primarily for our young people out there who are finding themselves in very troubling, difficult, challenging circumstances right now because of the crisis that we are all experiencing. We have a lot of other representatives from the child welfare field on the line, and we're grateful that so many people have taken an interest in this population of young people and want to rally around them. I think the message that I want to deliver, Sixto, more than anything else is a straightforward message to our young people out there, and that message is: we see you, we hear you, we care about you, we have not in any way forgotten about you. each and every young person in our foster care system or alumni of our foster care system matters. We understand in the Children's Bureau and the federal government that we have to demonstrate our commitment to you, not just during a time of crisis, but absolutely every day. For some of you who have not had the most wonderful experiences in our child welfare program, this kind of a commitment may not resonate with you. I do think that our current crisis highlights many of the existing shortcomings that we have in our foster care programs. And if there is a bright spot here, it gives us the opportunity to understand better how we need to prepare our young people and support them, not just in a time of crisis, but every single day. We believe here very strongly that it's absolutely unacceptable for a single young person in foster care or extended foster care to ever feel alone and unsupported, that they do not belong. They should never, ever be in that situation. It's a sad fact that we have 20,000 youth leaving foster care every year, many of those leaving without permanency in their connections, without the permanency of a home, a family, critical relationships. That is an unacceptable injustice to those young people, and we are on a mission to try and resolve that and rectify that situation. Whenever there is an emergency, such as the one that we are experiencing right now, it's even more important for us to be there for you. And that's one of the reasons that we're having this call today. Frankly, it should not take a pandemic for us to reach out and ask how everything is going and to be proactive about making sure that you get what you need to stay safe, to stay healthy, to stay connected. And frankly, we should not use a pandemic as an excuse not to reach out to you. Even though it's a very unsettling time for all of us, whether we're in the federal government, whether we're in a college dormitory or wherever, I think we have an opportunity here to model a new way to actively work together, to seek out your thoughts, your ideas, your voices, and to act on those things that we hear about. We've got a number of concerns that we're working on currently to address, many of which you have elevated to us, but I don't want you to assume that we know all that needs to be done or how to do it. We're continuing every single day to work our way through a growing list of needs and to find responses that are going to be satisfactory and helpful to you. Today, quite honestly, I won't be able to answer all of the many questions that have come up, but I cannot tell you how compelling it is to me that you're in a situation where you have to ask the questions that Sixto began this webinar with. Those kinds of questions should not be the kinds of questions that you're having to grapple with. We need your collective expertise. We need to make sure that all of your needs and opportunities are identified and that we can identify the best ways to address them. To that end, this call really is a first step. One of the motivators for this call is what we have heard about the concerns of young people attending universities and colleges that have closed or will close, and the precarious situations that puts our young people in. We need to absolutely make sure that every person out there has a safe place to go. We're equally concerned about young people who are in transitional living facilities who may have recently gotten a place of their own and may find themselves now in a position not to have their basic needs met or may not have access to the critical services such as medical care that are so important to them. And many of our young people, as we all know, are also continuing to reside in resource families, and we just want to make sure that those families have their needs met and attended to as well. At a very personal level, I've heard from many of you individually. There's a whole lot of people on the line today of our young people who know that I follow you on social media. I've been communicating with a large number of young people and alumni via text and email, but it's critical right now that we expand our reach and that we set up more formal challenges so that we reach out to you, we tap into your voices, we hear your growing concerns, and that we are positioned to respond to you as effectively as we can. We've taken some actions already. We have a lot more before us, but among some of the things that we've done, we've asked our state child welfare agencies to reach out to any young person who finds themselves in a situation where they're not going to have the housing that comes with living in a college dormitory, to reach out to offer assistance, to try to help find solutions for those situations. We've recently issued some updated guidance on flexibilities that we're able to leverage here in the federal government that will make it hopefully easier for some of the state and local child welfare agencies and organizations to reach you and to provide ongoing critical services. We will be issuing more around those flexibilities. At the same time, we're also looking very carefully and closely at possible legislative and policy fixes that might enable us to be much more responsive to you and flexible in our responses. It's times like these that reinforce even further the importance of all of us ensuring that youth and care establish meaningful relationships, have connections they can count on through thick and thin, even through disasters, no matter where those connections, relationships, and supports may be. I think I've made it no secret in talks around the country that I find it completely unacceptable that we fail to help young people in foster care establish those critical relationships and don't give them the permanency and relationships that they need. Our passion here in the Children's Bureau is growing stronger, and to be quite honest, this crisis reemphasizes that the messaging that we have been promoting here is absolutely on target. We have to do better by you. We have to go faster by you, and our promise today to you, even if I can't answer every single question, is that we will listen, we will hear you, we will act on what we hear from you this afternoon. We're going to get to questions in just a bit, but I just want to go ahead and say that so many of the questions that Sixto referred to a minute ago are from young people, and it reflects their very personal circumstances. I cannot address all of those circumstances in this setting, but we are calling upon our state and local child welfare leadership to be in touch with you. If they haven't been in touch with you, then I'm calling on you to be in touch with them, to ask for the assistance that you need, and for our child welfare organizations to stand ready to hear those concerns and respond to you. Many of the questions that we've gotten relate to taking precautions around testing and the spread of this illness. I do urge you to consult with the Centers for Disease Control guidelines. Those are the guidelines we're using in the federal government and doing everything we can to prevent the spread of this and to get past this very difficult time that we're facing right now. Many of the questions we will be able to respond to are those that are coming from the states, and we realize that may not alleviate many very immediate concerns and circumstances that youth are letting us know about, but the more we can equip our child welfare programs out there to be responsive to you and at the same time prevent the spread of this illness, we believe that that will benefit all of us in the long run. So Sixto, those are my opening thoughts here. I'll turn it back over to you.
Thank you, Dr. Milner, for that. You know, as I think about the struggle on the ground, one of the things that has just motivated me is how many people have actually jumped into action. It is the lifeline of the young people who are on the ground, are the nonprofits who are serving them. We heard stories bubble up, and I had to go ahead and invite Enith to the call. Enith, can you introduce yourself, and can you tell us a little bit about what is the experience on the ground? And then we are going to jump straight into some of the questions that have come in from the States and be able to answer those.
Yes, I hope everyone can hear me. And I am Enid Ray. I'm the CEO of Our Piece of the Pie in Hartford, Connecticut. We are on the ground level of both the crisis and figuring out how we continue to support youth. Really, our planning as a community organization has focused around how do we continue to stay connected in a relational way with young people so that we could provide that emergency support, that emotional support, and more importantly, we're concerned about how we can continue to pay young people, many of whom depend on the internships that we provide and the stipends that we provide through learning opportunities, so that they are not left kind of in the cold without any financial resources. So in talking with many of my colleagues around the state and nationally, one of the largest concerns is that as we look at all of the efforts that are being made to put together economic stimulus packages, to provide offerings in terms of unemployment services, many of our youth are left out of that because they're not really employees yet of an organization, right? But they're building their workforce skills, and it is not insignificant, the investment. Our payroll at OPP for March alone was $160,000 for 200 young people. That is significant money in the pockets of our youth in the community that goes to their basic human needs. So my question is, how could we work together to create some flexibility in those economic stimulus packages so that young people like those at OPP and in other communities can access, because their lost wages are real. Now that schools are closed, for example, they're not working in the after-school programs, right? Now that community service projects can't occur, they're not out in the community, but in limited sessions. So from community agencies who are also major employers, the concern is how do we continue to support the financial viability of our young people so that they don't get into even a larger crisis situation.
Thank you for that insight on the ground. Now we're about to go into the questions back and forth. Marina Nitza will introduce herself, and then between Marina and Edith, they'll go back and forth asking some of the questions that were submitted. Marina, would you like to kick it off?
Absolutely. Hi, everybody. I'm Marina Nitza. I run the Child Welfare Public Interest Technology vertical at the New America Foundation, where we have a multi-state working group that shares best practices. Thank you, Dr. Milner, for allowing many of the participants to submit their questions today. The first question is there a central resource for finding things like policy language, sample letters, online foster parent training, other resources that states can reuse so they're not each having to develop that independently? You're on mute.
Okay, now I think I'm unmuted. All right. Yes, the answer is yes. I'd like to highlight just a couple of resources there. At the Children's Bureau, we have just recently set up a page on the Children's Bureau website that is devoted to being a central resource, particularly for our policy language, our guidance, letters that we're sending out, other helpful sources of information that young people out there might find useful. I also know that Sixto and Think of Us has created a website where they'll be gathering that kind of information as well, and probably, I think, Sixto, don't let me go too far out on a limb here, information from other states in terms of how they are addressing specific kinds of issues, so that it could be almost an information exchange right there. Our webpage is growing by the day, as it should, and I hope folks will check that out. I think Sixto will be pretty well positioned to send out the links for both of those websites so that folks will know how to get to those and take advantage of those resources.
Thank you, Jared. Edith, you're on mute here.
I have a question that I'm sure is of interest nationally. If we issue staffing waivers for our congregate care facilities, will we still be able to receive federal funding? This goes to the question of what type of flexibility will federal, state, and local child welfare agencies provide to providers?
Yeah, we really don't have any federal requirements in our child welfare laws about staffing ratios for congregate care facilities. So there's nothing there for us at this level to actually waive for states. We would certainly encourage states to consider whether or not any kind of waivers like that might affect licensing or accreditation of those facilities. As you know, all child care facilities out there must be licensed in order to claim Title IV for a child that's placed in that kind of a facility. And there is one type of facility under the Family First Act, a qualified residential treatment placement, that has to be accredited. And I believe that the accrediting bodies themselves probably have staffing ratios that would be applicable to those. So states would need to consider that, but just once again, we don't have federal requirements that are tied to funding for particular staff ratios here.
Marina? Sorry, Marina, you're on mute.
Are there any considerations or guidance on adjusting response times for CPS calls and or face-to-face meetings in cases that are deemed higher risk?
Yeah. We just sent out what we call a Dear Child Welfare Leader letter to the child welfare agencies in the country, addressing the issue of conducting child protective service investigations where abuse or neglect have been alleged. We do not have, once again, in the federal government, any specific requirements in our policies, regulations, or statutes around response times. When we go in on our Child and Family Services reviews, we're actually evaluating states on their own policies around response times. I do think, and we pointed this out in our guidance to states, that we encourage state and local child protective service agencies to work closely with their state and local health officials in regard to conducting investigations, including those situations where there's a question around initiating in-person contact or not. Our biggest concern here and our biggest caution is that whatever procedures states and local agencies adopt, that they don't leave children in unsafe situations, but that they take all precautions, but also take all opportunity to make sure that our children remain safe when those reports are coming in.
Dr. Miller, this question really goes, I think, to the impact for agencies on the local level, much like OPP and others who are providing on-the-ground care. And the question is, would ACF consider extensions on time-limited grant dollars, such as Kinship Navigator programming, where programming and associate spending is delayed? There's a secondary effect in all of this that is not the focus of today's conversation, but is very real. And you talked about it early on, which is how do we do what is necessary now and I'm speaking from a community provider perspective, right? How do I do what I need to do for our young people now without worrying about my bottom line later? And how do we continue to keep our mindset and focus on youth first, their health, their wellness, their safety, without thinking at the end of the year, I'm going to have a hole in my budget. That adds a whole different level of stress.
Yeah, and I hear you loud and clear on that, and I share your concern. In general, we're looking for every flexibility that we have in our programs, and trying to extend those flexibilities so that you can meet the needs of the young people that you're working with, and also maintain your own viability as an organization so that you can continue to meet those needs. There are times in our grant money where there are very specific time limits that are written into the federal law. If that's the case, administratively, we don't necessarily have the flexibility to delay the end of those time periods. But if we do have flexibility within our control, to answer your question very specifically, yes, we want to exercise that. I should also note that we are working closely with folks on the Hill who have a very serious and committed interest in making sure that we take advantage of any opportunities there, even some that might require a legislative fix in order to do what's necessary right now, as you say.
And I would just add that if that came to pass, I know that you would have great support from community agencies across the nation. So please ask.
Thank you.
We have a question from a state wondering about face-to-face visits for kids that are placed out of state, and if there are options to maybe complete those courtesy visits via video or phone call during this time.
Yeah. Thanks for the question. I've had that question, as you might guess, put to me a few times over the last few days. Yes, and I don't think it's just applicable to kids who are necessarily placed out of state. There's a lot of concern about face-to-face visits when they're even in state where there's some reason to feel concerned about the health and safety of the kids themselves, and again, trying to protect the spread of this disease. We just have issued a policy question and answer to our child welfare policy manual that will permit agencies to use video conferencing to meet the Title 4B, that's the part of the law, monthly caseworker visit requirements under some circumstances. Again, I have to be concerned that we see our kids out there. It's one of our primal responsibilities right now, without undermining at all or underplaying the challenge that it presents to us. We have to be able to check on children in vulnerable situations, and we have to be able to see them, and we have to assess safety at every contact, whether that's by a video conferencing mechanism or whether or not it's in face-to-face. But we have given that flexibility under some circumstances.
I would just pick up, because the next question continues this thread of, how this is also impacting agencies to do their best work. Even in the best case scenario, and we consider ourselves an agency that's tech savvy and has technology available to youth, we have found that this has pressed all the boundaries and limits. So figuring out that video conferencing is becoming more difficult than we anticipated. And some of the things that we're trying to do is offer our staff, for example, a stipend for their phone if they can use their phone for those purposes and connect with our young people. But this next question goes also to that about the equity, parity, and how do we support the people on the ground who aren't generally thought of as first responders, but we know in this scenario, right, they are first responders for our kids because they're often the people who have the pulse. Will there be childcare resources made available for social workers on par with that for emergency workers and first responders?
I'm not really able to give you as definitive an answer on that as I'm sure you'd like for me to be able to. We are in close communication with the other federal agency here that we're associated with that administers the child care funds to determine just what is possible out there. This is a recent question that's come to us, and we will get some guidance out there on that just as quickly as we can. We just have not been able to get that quite firmed up enough for this afternoon's call. But thanks for raising it, because we have to protect the viability, the health of our workforce if we're going to protect the viability and the health of our kids.
Thanks for sharing that. And I believe I've heard some states are trying to build that in, writing in that social workers are essential workers for child care purposes. Our next question is about flexibility for states regarding meeting federal requirements like Title IV-E, performance improvement plans when things like courts are closed or you aren't able to make certain face-to-face visits, et cetera.
Yeah. We, as part of one of our Dear Child Welfare Leaders letters that we have just sent out, we have acknowledged that we are going to be rescheduling some of the upcoming federal reviews. We've had requests from 3 or 4 states to reschedule pending reviews that are coming up, and we're happy to try to work with states to accommodate those requests. We also know that a number of states are working on program improvement plans out there that have a lot of deadlines, and states are fearful about being penalized for not meeting those deadlines when they are focusing their attention in other places as they need to do at this time. So we've also given flexibility there around renegotiating the time frames for renegotiating some of those program improvement plans, extending deadlines as we go forward in order to accommodate the emergency work that's going on right
now. We have a question about best practices. This is a great one for everyone to be able to share. Are there best practices that can be shared relative to tracking of visits that are completed via technology, such as FaceTime, Skype, to ensure these activities are accurately reflected? I would just add what we're doing. Zoom actually, and some of the other platforms like GoToMeetings and others keep a log. And so we're using that as part of the evidence, right? Because we're in the space where things have to be evidenced as we go forward, that we have maintained appropriate contact with our youth, that we continue to use best practice in terms of our relationship building. But do you know of other ways that perhaps you've heard or your team has explored to evidence that connection with young people?
Yeah, we're looking at that right now. We're asking one of our TA providers to do a search of the literature to see what is there. I'll be just very frank. I don't think there currently exists a lot in the way of best practices around this, because I don't think it's a best practice, if I'm quite honest with you, to conduct face-to-face visits this way. This is an emergency measure, and it's not something that we would want to promote as an ongoing way of doing business. So I think the existing literature and experience that we have is how to be effective with those face-to-face visits. Having said all of that, I love the example that you just gave about being able to track that, and I think the more that we learn about that through your experience and through the experience of others who are doing it, we'd like to put that stuff up on our central website. I'm sure Sixto would like to do the same thing, so that we can begin to share those kinds of practices that are helping to facilitate contacts and assure that kids remain safe even during this crisis time.
Yeah, I agree, and I co-sign your statement of this is not the best way, right? We are fortunate, though, that in today's technology, we can even see each other, however. And that is, I think, the biggest loss that we've seen, and the biggest concern from our young people is not being able to connect with their youth services staff at the agency. These are the staff that believe in them, that give them the pat on the back, the occasional hug when needed, and all of that has come to a grinding halt. And so we're all figuring out, right, how to still be close and connected while having to be distanced. And that's a hard thing to wrap our heads around, and especially for young people.
Yes, and you said it far better than I could say it. That I agree with you 100%.
This next question is it helpful for states to maintain lists of things like court closures and docket cancellations so that downstream, if there's any impact on the data that they're reporting to the federal government, it can be justified?
Keeping a log of those closures, I'm not sure what the context would that be, if it's to justify not having had a hearing for purposes of a review or something like that. Our intent, quite honest, is that when we are on a regular review schedule here, not to use the time frame that we're in right now as part of the period under review, because things are so in flux and quite different from what the norm is. But even with that, I think that one of the things, and this may go to another question, I don't know, but we are working very closely with the national legal judicial organizations out there to try and address all of the effects of court closures or altered court procedures. I don't mind telling you, I'm hearing some things out there that cause me great distress. And we would like to reach the judiciary to explore with them ways in which we can continue critical functions like parent-child visitation. We don't want to disrupt that integrity of a parent-child relationship while we're in this situation, in ways in which we can do that. We don't want to delay, for example, reunifications that would require some court decision to make that happen, or increases in visitation. Some of those critical things there. So we're very much in tune with that part of the child welfare system, but I don't think we're asking states right now just to keep a blanket record of what's closing and what's not. But if states want to do that, of course, that's certainly just fine.
Yeah, my question is a follow-up to that, and it's really about the coordination with juvenile justice agencies and the dual enrollment for some young people in child welfare, that they're also part of the juvenile justice system. And we're not clear, right? We're falling into this as an agency. What constitutes a violation on one side may have drastic impacts on the other side that may destabilize a home placement or other for a young person, and figuring that out, right? There isn't clear guidance. Is there any thought about some coordination and unified guidance about how we can treat those type of cases?
I'm glad you raised it. I think it's a prime area that we can look into right now. I'm not going to represent to you that we've gone very far down that road. We're aware that there may be some potential conflicts there, but this gives us an opportunity to really, and a prompt, quite honestly, to look into that and see what kind of guidance we might be able to jointly issue. Thank you.
Okay, and I think you've addressed this partially, but I still want to make sure I ask it in case you have additional comments. We understand it's essential to complete in-person interviews with children involved in CFSR case reviews. Will there be leniency when this is attempted, but it can't be accomplished due to family safety needs or other reasons?
Yeah, again, our hope is that when we won't begin round 4 of the CFSR for a little while yet, because we're making some modifications to the process. And our hope is that when we do resume those, that we might not be able to use this particular time period, which may look a lot different than other time periods there. And I'll just refer back to what I've already said around the use of video conferencing as an alternative to that, which is a form of face-to-face, but it is not really face-to-face. We would encourage states to make the best use of that as they go forward right now.
Dr. Milner, as we're wrapping up these sets of questions, we're getting a lot of messages inbound, young people texting me, very much what's on their mind, right? We had 350 young people from across the country register to tune into this. And can you speak to any type of recommendations around college? Right? We're getting so much inbound around young people saying, my dorm has closed down, my meal plan has closed down. I know you wrote a letter, and I wanted you to be able to speak to some of the efforts that you have been able to do to date.
Yeah, again, Sixto, that whole situation has been the real impetus, in my mind at least, for having this call and for reaching out to the young people. I know that there are so many other needs, and I've seen that by all the questions that are coming in. But this issue of our young people being displaced when dormitories are closing, and it isn't just a matter of housing, as you well know, it's also a matter of having food to eat. It's a matter of having access to computer equipment, even if classes are going online, it's a matter of having access to internet so that they can participate in the online activities. Again, our letter to the child welfare leaders and directors recently was, in my opinion, the strongest call to action that I think we could issue out there to contact those young people out there, whether they are currently in the foster care system, extended foster care, or alumni of the foster care system, to assess their circumstances, to offer the supports that they need. I think that specific answers are going to vary depending upon what a particular individual's circumstances may be, whether or not there's a relative that might be explored, or a former resource family, or someone else who might be a resource for the child out there. But we want our child welfare agencies to be taking the lead and contacting those young people to make sure that their needs are met. I'm hearing from them also. I've also heard that a few of them have been able to use our call to action to get some needed relief there. I hope that's the situation. We've also encouraged our child welfare leadership in the states to work very closely with the universities and colleges themselves to try to avoid some of these circumstances from ever happening in the first place. I'm hearing anecdotally that is happening, but from the list of questions that I got today from young people here, I know that it's not across the board yet, and so that means our job is not done.
One of the things that some young people have been able to do is use that letter as part of their petition to be able to stay in their dorm, and that has been successful for some young people. So those of you who are watching, I encourage you not only to use that letter as your petition if you're in that situation, and if you're not in that situation, there are 350 of us on here. We're well connected to other foster youth, making sure that we reach out to our foster brothers and sisters across the country, and that we're also sharing the knowledge that we have. You know, we're getting some more inbound here, and people are asking concretely, what are some of the things that young people are saying that they need? And what we did was we took the 1,400 submissions that came in, and we did a word count, and the number one thing that came up was food. And this disturbs me a bit because we're talking about basic survival. The fact that our young people are not only just worried about where they're sleeping, where they're going to live, in the tough situation that they're in, but they're worried about food. So I want to repeat that list because on this call, we also do have funders, we do have advocates, we do have other people who are looking to jump into action. And so the top 10 things that have came up from the 1,400 submissions from across the country, number one is food. Number two is housing and shelter. Number three is healthcare. Number four is tech. Number five is financial assistance. Number six is employment. Number seven is transportation. Number 8 is education. Number 9 is housing supplies. Number 10 is parenting and childcare. These were the 10 things that came directly from young people from across the country, and we were able to do a word count to figure out what the order of urgency that is perceived that young people are pushing out. As we wrap up this call, Dr. Milner, what are some words that you can say directly to the young people who have tuned in today?
Well, I want to reiterate, even though it may not feel like it for youth who are in very dire circumstances right now, that we are working diligently to try to address those circumstances, to try to put into place procedures and flexibilities that will allow us to reach out to you. We do care about you. We want you not to be in those kinds of situations. I would say if you can check these websites routinely for updates or resources that may be available to you, continue to tell us what your needs are. We're going to do our very best to make resources centralized and as up to date as possible. So there's one easy place or one or two easy places to go from your phone or wherever you are. For states, for counties, for others that are on the line, other agencies or groups that are interested in serving our youth, I also encourage you to go to those websites to stay on top of how we can help our young people, to encourage them to encourage those organizations to be as responsive as absolutely possible. We're committed to trying to give the best and fastest responses to the questions and concerns that come in, and we're working just as fast and as hard as we can to do just that. So thank you for letting us have this opportunity today to meet with you.
Thank you. One of the things, I hate to put you on the spot here, but I just have to ask, can we get a commitment from the young people here that you'll circle back with the states and ensure that they are checking in on young people and send that reminder to them? A lot of state leaders have a lot on their mind right now, and we want to make sure that our young people are not forgotten.
Yeah, we're absolutely going to be in regular communication with state agencies to get a sense of what's happening and what the emerging needs are. You know, Sixto, one of the biggest things I think for all of us right now is communication, and communication has to happen frequently. It has to be substantive. Things are changing very quickly. People are coming up with solutions that we sitting up here may not necessarily be aware of. And needs are emerging that we may not be aware of. So the communication and regular follow-up is our commitment right now. Thank you.
Thank you. Thank you. All righty. Well, with that being said, any departing words from our two other co-presenters here?
So I just want to thank you, Dr. Miller, and think of us for really standing for young people in a substantive way, holding us accountable to do the good work that we're trying to do on the ground. And I really look forward to being part of what is now a growing national community thinking about young people, which for us at OPP warms our heart, because oftentimes we feel like we out there, and it may feel lonely at times. It's wonderful to know that there are other resources and other colleagues that are thinking strategically and thinking hard on these issues and are willing to help us approach our funders so that we can continue to do the wonderful work that we do on the ground for young people. So thank you.
And I just want to reassure the young people on the call that I have been heartened by the rapid responses and passion and care that the government, the state leaders, and the nonprofit agencies have really been exhibiting in this time, reaching out, trying to share resources. My working group has been exploding with people just generously offering online foster parent training resources, letters, shared policy. And that might sound boring to those of you that aren't in government, but that's actually how we make it so that those frontline workers can best serve the youth. So keep tuned to the websites, and we have a commitment that we're going to make sure that any resources for you and for the agencies that serve you have resources there as quickly as possible. Thanks again, Dr. Milner, for this call.
Thank all of you.
As we exit here, I just want to remind folks that to check back at the Think of Us website for the updates on the resources that we're going to be able to, we're standing up right now. The website that we are standing up right now. We'll also be emailing you a link to the video of this call, And I want to speak directly to the young people who are on the call right now. If there was ever a time for us to be able to play a concrete role in shaping what our child welfare system can be and should be, this is it. So those of us who are home and able, we are able to digitally mobilize. So we're going to be calling out to young people to, one, make sure that we're building community, but two, to also make sure that we take this opportunity here to make sure that not one young person is falling through the gaps. So with that being said, this is not the only time that we'll be reconvening. We'll follow up with a lot more answers to a lot of the questions that we did get, and we'll be in touch. Thank you all.
Thank you.